This is Dr. Scott McLean, and this is a video about DBM Bone Putty, which is a putty used to prepare the ridge prior to doing dental implants. We're going to be using Creo's Allograft, which is 100% human bone. The bone comes out of a dispenser, which is a syringe, in a putty format. It's 0.125 to 1 millimeter particle sizes. During this video, we'll be demonstrating a socket grafting procedure. You can also use this in lateral ridge augmentation and also sinus lift, as well as many other options as well. So we'll be taking the bone, which looks like this under SEM, and we'll be using this to mold it into a putty and then put it into a socket, and we'll show you exactly how this case turned out. Now, before we show you the case, we're going to look at the various sizes that this putty comes in. You can see that it's very easy to mold, and it's a precise adaptation to different defects. So the sizes are typically 0.5, 1, and 2.5. The live case will be played in just 1 second. Let's look at a few other things. You can do extraction sockets, fill void around dental implants. You can repair periodontal defects, among many other things. The Alligraph putty can be ordered under the 3 sizes. Now let's look at our case presentation using the DBM Bone Putty, which is an allograft. The patient came in and he had a failing 3-unit bridge, which was a Maryland bridge, and we just couldn't repair this. We were going to have to take out a tooth, which you can see that there's quite a nasty root on this one. If we look at the situation, you can see the bridge going from the canine to the second premolar, and so we're going to take out the posterior 2 teeth, and we'll show you exactly what we're going to do. So looking at this case a bit closer, the plan was we are going to then look at the abutment and then the pontic and the other abutment, and we're going to take it and then we'll cut it. So we'll cut it right through here with a diamond, and we'll release that metal aspect of the bridge, and then we'll come in and take out this second premolar, because this is the premolar that's holding that posterior aspect. We'll take the bone putty and we'll place it into the socket, and we'll put a membrane in, collagen membrane, and then we'll repair this and let it sit for 5 months, come back and place an implant. And we're going to cantilever, because we cannot put 2 implants in here, so we're going to cantilever forward and repair this area for the patient. So we'll begin the case by cutting the bridge. So I'm using a diamond 8850 KR diamond, and I'll cut the bridge and get the metal aspect of the support on the abutment, and we want to get at that posterior tooth. So as I'm grabbing this, I'm noticing that it's not too cooperative, and it was feeling pretty solid. So I didn't want to destroy the bone in that area, so it was really not moving too much, and it had a hook on it, so the crown did come off like it normally would. And you can see we decided that we'd go back in and we'd use our special instrument, and you can see here the piezotome cube, and this is a fantastic tool from Salvin. You can see the tips. We can use the tips to go down and around the root and really protect the bone as much as possible. So we tighten down one of the tips, and we're going to go in and use ultrasonics with saline, and also the tip, and go in with a diamond tip and dislodge that root and get it out of there very quickly. So we raise a flap, and we'll get in there and do some work on that root tip. Once the flap is elevated, we'll be able to have a good look at the root itself, and we can get in with the piezotome. You could go in with a mallet and other instruments, but we're going to go in and try to dislodge this in a very non-threatening way to the bone and try to preserve as much as possible. But we are going to have to do a ridge preservation here, just due to the nature of the root itself. and because the root is really not that cooperative. You can see it's got a little S curve in it, but the endo is not got an S curve, so someone had a little bit of trouble. But this has been here for 20 years, this bridge, so very successful. But now time to move into the implant repair session. So you can see we get the root out and we can get rid of that, and the patient's glad that that aspect is over, but it was easy with that. So we're going to take the bone putty. So this is an allograft, so coming from human source, comes very all sterile, and so we open the internal sterile bag, and then you open that bag and you get to the bone putty. And I'll dispense the bone putty here, and it feels a little bit like a waxy putty. So it's I wouldn't say completely firm, but there's a firmness to it. And when I put this in, I'm going to be able to mold it. So there's a few things that you can do to this putty when we can look at it and just press it into the shape that we're going to need. But we can also do some other aspects to it. So it's kind of an interesting way, because normally we have powder. So this allograft is 100% human bone, and it's called Creos. So it's doesn't have fillers and it has an inert carrier. So it looks like this, and it feels very wax-like to me, and it has very moldable. Now you can add bone. I didn't on this case, but I have on other cases. Add in some allograft or xenograft. You can add that in, and this would make it a little bit firmer. You can also add quite a bit of that and make it even more firm. So that's one way. I'd like to have a tip that would dispense it and inject it into the different roots. That would be a nice add-on here. But we can also add blood to it, or we could add some PRF to it. So one of those aspects. So I'm going to take a vicryl suture and prepare this site for the putty bone graft, and then we can make this so it's going to be a success story. We're going to do a lingual loop of the suture, and I do this by passing through the lingual tissue, and then I'll pass again, so I'll loop it and then cross underneath the loop. So this allows you to have a firm suture without even tying a knot, and this will allow you to then have that suture placed prior to you putting in the collagen membrane and prior to for you to place in the Allograft Bone Putty. So we can see here that the suture is going to be ready, and we can use that to tie up. We will contain the putty using a Creos Xenoprotect collagen membrane, which is a very resilient membrane with a lot of dense and strong fibers. You can have a really difficult time to try to tear this. And these membranes come in different sizes. We're going to use the 15 by 20 on this case. So this again has sterile packaging. So once you're inside, you have a sterile package that you open, and you take the membrane, and we're going to sometimes cut it and make it into either an ice cream cone shape, or we would make it into just a flat shape here because we have a larger region to cover. So we're going to use the whole membrane on this case. So you can wet it so that it's going to stick down a little bit better, and we're going to tuck this in prior to put the putty in. So we want to do this first. So we want to contain the putty graft. The putty graft is not going to wash away by saliva or blood, but the graft itself is going to be contained in the socket area so that we can make this a good solution for long-term success. On this case, I molded the putty into a shape that will fit into the defect, and then pinched it off and made it smooth. And we'll come back and shape it a little bit more with the prosthesis, and I'll show you that in a minute. So we took it, and then we're going to start to suture. So I'll take the suture, which is a vicryl suture, and I'll come in, and most people can do this no problem. This is something that you're going to save the patient a lot of hassles if you can get this done, even if you're not placing the implant. If you do this, it's going to help whoever places the implant to get some solid bone rather than letting this bone collapse, because they can collapse and then soft tissue can grow in. So we want to try to protect this and make it so it's ready for the implant. And we're going to place a implant in 5 months. So I'm going to pass through the buccal and come to the lingual, and I keep tying my suture off. So I will do a tie and make it so it's going to be in good position for this to secure the bone graft, because you do need to secure it. You can't just put it in the socket and leave it. I found that that's just not going to be acceptable. So you can see I'm doing a third pass and we're suturing this down. Now the tissue may not close completely, and we didn't score the tissue because we're not really tugging this too far. What we're going to do is let the tissue of the body grow. The tissue will grow from one area of the gingiva to the lingual aspect, and we'll get a nice closure on this case. So I'll tie the suture back off and secure this bone graft, but it's in the putty, so it's a bigger mass than I'm usually used to with the the particulates. And so when you have different bone sizes in saline, they tend to wash away a little bit, and I found that the patient would say, I've got this white stuff in my mouth, and you want to keep as much in the site as possible. So you can see here the site is tied and ready to the next phase. To review the suture technique, I did a loop on the lingual right here, and then I looped back around and then under-tucked it. Didn't tie it at this point. And then what I'll do is pass over the middle, loop back, tie it off, tie it off, tie it off. So the suture's not moving because it's snugged up on the lingual, and which makes it a lot easier to hold that membrane down. We're going to do a temporary that helps us to shape the bone graft. So we're going to use our Pro 2 from Sprint Ray, and I'm going to build an Essex temporary. Before taking the tooth out, we did an intraoral scan, and we'll use that intraoral scan to build an Essex appliance using Sprint Ray technology. And so you send it to Sprint Ray, they can design the STL file, and then you'll be able to print that. And so you'll just take the resin and start to get a final product that you can use to help in your bone grafting quest. So once this is fabricated, we're going to come back and we'll use this guide. So this is really a soft tissue guide as well. So it's going to help to hold the tissue in position and keep everything nice and clean. So we do want to take the scaffold off. The scaffold is always on the occlusal surface because you don't want to be doing a lot of cutting of it. And so we'll take some flowable resin, and we're going to shape some ovate pontic forms so that we can shape the putty. So we want to take this and push it up against the putty to allow us to make hopefully some shaped papilla with the bone graft. It takes only a few minutes to put the flowable in. You pick a color that's going to be compatible to the patient, and you saw that we can light cure this, but once the patient has this done, it's going to look way better than it did when they came in, because he had a very dark tooth that was being destroyed by caries, and so this is going to improve the situation and make him feel better about it. So we'll shape that and light cure it and get it all prepared so that the patient is going to walk out with a tooth. And that's what they're usually concerned about. Am I going to have a tooth after all this work is done? And so we can tell them that yes, you will. We'll shape it with a diamond, and I'm not going to polish this too much. I may come in with a sanding disc and just make this so that it's not going to bother their tongue. So it's very quick and easy, and we already have this prepared before the patient's coming in, because the patient was in to look things over and to look at the chances of placing an implant. So this is Dr. Scott McLean, and don't forget to give this a like, and hopefully you can share it with your friends and send it around the world.